Hi, good morning. How are you? Hope you are doing well. So today's video is about hospital patient transporter. So what is a hospital patient transporter? If you don't know, my name is John. I have worked as an EMT in Los Angeles for about 2 years. I also work in a trauma hospital and a psychiatric hospital. And right now I'm working in the mental health field. So let's just jump into it. What is a hospital patient transporter? If you could guess, just from the title itself, you pretty much transport patient from point A to point B. But the thing is, it's a little bit more complex than that. So let's get the basic down first. What is the educational requirement for this job? For the educational wise, all you need is a high school diploma or GED. Yes, that's it. All you need is GED or high school diploma. For the license or certificate, all you need is a BLS for healthcare provider. So basic life support for healthcare provider. I got mine from American Heart Association, and it's only 1 day of training. So that's all you need for this job. So education, high school diploma, and certification is BLS for healthcare provider. Remote, make sure it's healthcare provider. So I want to give you a quick overview, a kind of quick run through on how my day as a patient transporter. Also here, a quick tip. I'm also a patient transporter dispatcher too. So I was a patient transporter and I got promoted to a patient dispatcher. So this is how a normal day would be if you work as this job. You come in, your dispatcher or me will give you a call. You will get a call. So during the call, you will get your patient name. Let's say John Doe. You have medical record, the patient information, the room number, the floor number. So it will be like John Doe, medical record. The room number is, let's say, on the 4th floor, 404, right? And the nurse I call for this patient to bring the patient down. Where is the patient going? The patient will be going to, let's say, radiology. So you have to go get a gurney. You get the gurney, go bring up to the 4th floor, go to the room. Before you go to the room, you have to go to the nurse station and say, hey, I'm here to pick this patient up to bring down to radiology. The nurse I call for this patient is this nurse, and then you need to make sure you get the nurse for that patient to be okay before you take the patient down. So always have to communicate with the nurse and the nurse station, the charge nurse, make sure everyone knows what's going on. And then when you get to the room, you say, hey, hi, my name is John. I'm the patient transporter. I will take you down to radiology for this procedure. And you check with the patient information. Are you John Doe? What's your medical record? What's your date of birth? Before you transfer patient from the floor bed to the gurney. You take the gurney down to the radiology. So let's say the patient go down to radiology for ultrasound. So you take the patient and go to ultrasound. You hand up the patient, get the signature from the ultrasound tech, and you're done for the call. That's it. That's your call. And then if the patient is done, they will call the dispatcher. The dispatcher will call you, and then you will go get a patient and bring a patient back up. So that's very simple how to go about your day. What are the typical locations that you will transport the patient to? Again, this is very depend on the hospital. Some hospital you will go all over places. Like for my hospital, I work in a trauma hospital. So literally, I go from the floor, let's say a med surg, burn unit, go down to radiology. So it could be CT, X-ray, Nuke Med, GI lab, Cath lab, like special room for any type of special procedure. Or you could take a patient from the waiting room, go to L&D, labor room for mom giving birth, or go down to the 1st floor, go to maternity ward. So as a patient transporter, you go all around the hospital, moving the patient around. Another thing that you also do is you help the nurse with the ER and ICU. So let's say the ER, the patient get treated, get stable in the ER, they will need to move the patient to the ICU or go up to the floor. So the nurse will call your dispatcher and say, dispatcher, if I'm your dispatcher, I'm going to, hey, I got a call from the ER, and the ER, let's say Lisa, the nurse Lisa leading you to go to the ER to help her move the patient from ER to ICU. Stat. So that's what you're going to be. So you go get the information from the patient, and you go to ER, talk to the nurse and say, okay, you need to get this. Usually when you move a patient from ER to the ICU, you get a heart monitor. If the patient on oxygen, you need to get oxygen tank. But it should be quick move. the nurse should able to get everything ready for you, so they should need you to help them push the bed or any type of assistant to the ICU, because usually when you move the patient from ER to ICU, it's a lot of if they are a critical patient, there's a lot of stuff to go with them. And then when you get to the ICU, you just help the nurse, the ER nurse, and the ICU nurse move the patient from the ER bed to the ICU bed. And after that, you take the bed back to ER, and that's it. You are done for that call. Now, let's say from an ICU, go up to the floor, to the main floor, like med-surg or the burn unit, stuff like that. The ICU nurse will call, you come in, help. The same thing like ER, where you set up the heart monitor. Let's say if the patient on IV pump, if you need to bring an IV pump, then you have to bring the whole pump with you. If not, you could disconnect the saline, talk to your nurse. This depends on what, make sure everything is okay with the nurse first before you disconnect anything. So you do that, you bring the whole bed up to the floor, and then you move the bed, move the patient from ICU bed, move the patient to the floor bed, and you take the ICU bed down to the original where you took the patient from, and that's it, you're done with the call. So there's a lot of moving up, down, from one place to another. So that's your main job as a patient transporter. Sometimes nurses or security will call you and say, hey, I need equipment. Most time, if you're really busy with patient transport, you do patient transport first. That's your priority. You don't do anything if that's not your priority. But sometimes, let's say you're on a downtime, you have time, you will help out the security guard, you will help out the ER, the department that need help with equipment. So let's say, oh, the floor need a bed for a patient from ER coming up. We don't have any more bed, the bed's broke down, can you get more bed? So we have to go run around. You call house soup, you call any engineer, say, hey, engineer, hey, house soup, the floor, let's say, med-surg 4-5 need a bed. I can't find a bed. Where can I find a bed? So you have to talk. Your dispatcher will talk about, like me as a dispatcher, I will talk to charge nurse, I will talk to the house soup to figure out where the bed go, the wheelchair, oxygen tank, stuff like that. And then there, I would delegate my staff to go and get it and bring them to the department that need the equipments. Now, there's also time that you also have to take the bodies down to the morgue. So I work in a trauma hospital, so there's every week we have someone pass away. Now, I try to make sure that my staff, my team, are spaced out with the handling the morgue situation. So there's day that's like, hey, this patient will take care of the morgue. This patient, this staff will take care of the morgue the next day. So I make sure everyone's spaced out. So you don't want to take care of the morgue every single day. Usually your two equipment that you use to transport patient are gurney or wheelchair. Again, gurney are your most used equipment because most patients in the hospital, especially in my hospital, they are critical ill, so they cannot walk, so cannot stand or cannot sit, so therefore they use it on big gurney. But let's say some patients are kind of okay, or they are there for labor, or they get giving birth, then they usually go transport by a wheelchair. So let's say I would take a patient from this ER to the labor floor, I would just take them by wheelchair. Or you would take the mom from the labor floor down to again ultrasound wheelchair, unless she's not comfortable with using wheelchair, and you take a gurney. So it just depends on the situation. Usually you will see a lot of patient transporter in the hospital where they take a patient by either wheelchair or gurney. So that's, if you see a staff that taking a patient on a wheelchair, that use a patient transporter. This is a good entry-level job for anyone out there that are interested in working in a hospital or very much to see how medical setting is for you. I really recommend this job. Now here's the thing, the salary to pay for this job when I started out is $10.50 an hour, and then I think after a year it went up to $11. So that is usually the range. This is a few years ago, so I don't know about now. I will probably do another video on that later, on the pay. But I really recommend you to check this job out because it's a good entry-level job, especially working and seeing how the hospital run and interact with other nurses and other department, because as a hospital patient transporter, you literally go everywhere in the hospital. So you see the burn unit, you see the med surg, you see radiology, ultrasound, CT, you see ER, you see ICU. You work with every nurses. And then eventually, if you become like me, you get promoted to the dispatcher. You literally work with charge nurses and house soup. So let's say if my trauma hospital get divergent, meaning that the hospital ER is at max capacity and the hospital there's no bed and stuff, that situation, then it's pretty much all hand on deck. I have to work with the house soup. I have to work with charge nurse. Say, hey, this is the situation right now. The house nurse, the charge nurse or the house soup will call me. Hey, like, we need to move beds from ER to ICU to the floor. I need you to start sending people to the ER. Move this patient to this floor, to this ICU. So we need to clean out this ER to make more room for new patient coming in. I hope you learned something from this video. What's your thought on hospital patient transporter? Leave a comment down below and subscribe. On this channel, I talk about my life experiences in healthcare. Okay, hope you have a good day. Stay safe, stay strong, believe in yourself, and love yourself. Bye.